It's quite important because many times we don't think of mental health as an integral part of our health. In fact, even WHO for many years from its formation never recognized that. It was the recognition of mental health as part of health came in much later, many years after the foundation or the founding of World Health Organization. And in many situations and many governments, World Health has been perceived, mental health has been perceived as something aside from normal health. A lot of the times we hide the patients. We do not want them to be seen. And so this is quite a brave move when an institution comes up and we put up a rehabilitation and mental health center, which is open, which is visible, because it is important that mental health as an entity should be visible. It should be removed from the shadows. Right now, it is recognized that health cannot exclude mental health. So we are very happy and we welcome everybody, health professionals, non-health professionals, and the people in the administration, everybody, to recognize that right now Oasis has opened this mental health institution here in Kisii, and we pray that everybody recognizes it way beyond the region of Kisii and South Nyanza, and even Nyanza as a region.
Statistics say that if we have 4 people, 1 of them will be having a mental illness. And that is so disturbing that tunaweza kuwa 4 hivi na mmoja wetu. Already we are 4 na mmoja wetu ako na mental illness. And that one, again, we've been told that Kenya has been ranked 4th globally with people having the highest people with depression. As medics, we want to educate the society that mental illness is like any other disease. As we walk into hospital to be treated for malaria, to be treated for pressure, to be treated for diabetic, it is also good that when you see the signs of mental illness, these people should be brought to us so that they can be treated. We want to get away with that notion that mental illness tunasema ni urogi, like it is witchcraft. It is not witchcraft. It is a disease of the brain and it can be treated. We are really educating the society, like let's get away from this notion of just kufungia watu makamba. Ukiona mgonjwa amekuwa na kuchanganyikiwa, ukiona mgonjwa labda anaokota makaratasi akijiongelesha, huyo sasa ashaanza, mnamu-isolate, mnasema huyu alirogwa. Hapana, huyo muleta hospitali na tutamuhudumia. Ile moja yenye tunaelewa kama wa Kenya, mgonjwa anashindwa kulala, unakuwa na lack of sleep, you may be having lack of sleep ama unalala sana. Another one, you can be having mood swings. Unaweza kuwa disturbed, like unakasirika, hata kitu kidogo tu inakukasirisha, you're not able to manage your emotions.
Mental illness and addiction does not just affect an individual, but affect the whole community and the family. With this new mental and rehabilitation center, we are going to help a lot of people. We are opening the gates to our community. You can bring in your patient here and they will get the care they deserve. We are committed to provide holistic care for all our patients, where they get all the services that are needed, from occupational therapy to counseling to psychiatrist review. All the services that are offered in a mental and rehabilitation center are offered here. All the insurances cover for mental health problem. For addiction, it's just SHA and MKR for the police, but the other insurances offer offer insurances ama pays for the rest of the mental illnesses. Asking for help is not a show of weakness, but it shows that you are strong and you have identified that you have a problem. The first step starts by identifying that you have a problem. And at times, most of the patients who have mental illnesses are not able to identify that they have these problems. The families, the relatives are the ones to identify that their behavior have changed. The way this person used to behave, they have changed. So we have to be very keen. We have to be very observant. Suicide is on the rise, and there are those indirect signs that a client does not need to tell you. There are those signs that you can see. For example, a patient who was jovial, they have started having mood changes. All of a sudden, they have started taking alcohol excessively. They have started maybe having feelings of hopelessness. Those are just but indirect signs. So we must be very keen before someone reaches to a point of trying to commit suicide. At least we will have helped them. And we should bring these people to hospital. We should not rock them. We should not let them roam on the street. There is help, and by the end of it all, I can see there is light at the end of tunnel.
Gone is the time that we used to hide people who have mental health issues. Today, we have launched a facility where people can walk in confidently and share with our doctors, our specialists, or their mental health issues. Fortunately, for today, most insurances actually accept to cover for mental health illnesses. That's very fortunate for the people in the community. So people are welcome. SHA, as we have been told, SHA covers for mental health. SHA and all other major insurance also are accept to cover for the mental health illnesses.